Okay guys, we're going to go ahead and get started. My name is Ashley Wright. I'm the retiree specialist for the insurance department at LPSS. So I wanted to welcome you all to our second meeting, Meritain meeting of the day. And we are here to help you learn more about this change. So we understand that there are lots of things coming down your way, a lot of communication coming your way. This is just one of many opportunities that we'll be sending communications out along with this meeting and various communications moving forward to make sure that you understand all the changes that are coming. I wanted to reiterate open enrollment. So open enrollment is going to start bright and early Monday morning on September 22nd. This is your opportunity to make changes to your health insurance, okay? We need to make sure that if you do want to make a change with the district, you have to do it with our department. Please make sure that any request that you send our way, that you get a confirmation that we received it. That's super important. The deadline to make changes is October 24th. So we want to make sure that everybody gets their requests in by that deadline. Anything past close of business, which is 4:30 on October 24th, will not be accepted for open enrollment. As a reminder, open enrollment changes are effective January 1st of 2026. So any changes you make during this time, if you are moving to Humana or staying with Meritain and moving over, you're going to have your Blue Cross through the end of the year. So through 12/31 at midnight, you'll have Blue Cross, and then it will switch over to Meritain. There is, let's see, wanted to remind everybody that we're going to be having a Humana meeting following this one. If you would like to attend, and that's going to be at 2 o'clock. Let me double back about open enrollment. The one thing I've talked about making changes. If you do not want to make a change to your current coverage, you do not have to do a thing. We are going to transition you automatically from Blue Cross to Meritain come January 1st. So another point I wanted to make. We're going to have a very brief Q&A after this meeting. We do have the Humana one at 2, so we have to keep it brief. There's only a 30-minute increment between the two meetings. We want to make sure that we can try to answer as many questions as possible. We do have staff here. We can take your name and number and get back to you with any questions that you have. So we just want to make sure that you guys, we are aware that it is a lot of information. The open enrollment communications that are going to be sent out to you will be in bite-sized pieces. So they will be in small increments so that we can send out the information. You can digest it, read it thoroughly, and then that way, if you have any questions in between that, we can answer those before we move on to the next communication. Communications for open enrollment are going to start on Monday and are going to continue through open enrollment and beyond all the way through the end of the year. So just want to let you guys know those communications typically are going to be almost always email for sure and text. And there are a few mailers that are going out as well in the mail. So just wanted to let you guys know all of those items, and without further ado, we're going to welcome Miss Melissa LaMarche with Meritain. Thank you.
Good afternoon, everyone. How are you doing? Good, good. Thank you all for allowing me to be here. I'm thrilled to be here in front of you all. Again, my name is Melissa LaMarche. I am a representative of Meritain. So, I always like to start off with who is Meritain, because not a lot of people know that name. Meritain is a third-party administrator. We have been a TPA for over 40 years, so we've been doing this for a very long time. We were back in 2011 acquired by Aetna. And the reason why we were acquired by Aetna is because Aetna found that for some of their self-funded customers, those customers were looking for more customization, more solutions that Aetna was not able to provide. So they hired Meritain. We have our own claims platform. We administer claims and help with claims with self-funded customers. very differently than the way Aetna does, but the benefit to being owned by Aetna is that we get to access their network at no additional charge with deep discounts and national access. We also get to pull in resources from Aetna. So it's kind of the best of both worlds. We get to really do what we do best for our customers, but also bring in that Aetna component. I always like to give a little snippet of who Meritain is, because like I said, nobody knows who we are. And when in doubt, when you go see your provider, if they say, somebody at the front desk says, who's Meritain, just say, I'm with the Aetna network. Okay, that's always easier for them to understand. So, when searching for providers, this is actually going to be sent to you. So I know that the link looks kind of small here, but don't worry, you can actually just click on that link when it's sent to you. It will take you directly to our provider search, the Aetna provider search. So I highly recommend that you be proactive and looking to see which one of your providers is in network and maybe explore alternatives if you're looking for additional providers. But this link will take you to an area where you can either indicate your zip code to find providers, the name of the provider, or specialty. You just want to look up by specialty. All right. A couple of tips I will tell you is that with the provider search, one thing is that MDs, providers who are MDs, are usually the ones contracted. So if you're trying to look for a nurse or a nurse practitioner and they don't show up, don't panic, because usually those claims are all submitted under one MD's name, under a big group of providers. Another tip is that if you do have a large group of providers, like you have a large cardiology provider, and they have, let's say, 20 providers, not all of them want to be contracted because, again, they're filing all their claims under maybe one or two providers from that office. So again, when in doubt, call customer service and ask, or you can call your provider and ask, do you accept Aetna Choice POS too? Okay? And they'll be able to let you know. Or you can go to the site and search up other providers from that practice. Okay? We, prior to, received a list of all the providers that you see currently, and we ran a disruption analysis to see if there were any gaps. Please note that any gaps we're actively trying to, we've got a team behind the scenes that's actively trying to close that gap with providers who are interested in joining the network or through different solutions. Okay? You also have access to the Verity network, which is a regional network here for Louisiana. So if you don't find your provider under the Aetna network, you can also search the Verity link, which will also be provided to you by Trish and her team, and you can see if the provider falls under the Verity network. So it's almost like Verity is wrapping around the Aetna network for more of a local presence. Okay, like I said, you can call customer service or ask your doctor, so perfect. One other thing I wanted to mention is that we were also asked that all of your current benefits that are in place today, so co-pays, deductibles, visit limitations, exclusions, everything that's on that plan document, we will mirror that. So that will not change for you. So co-pays, deductible, co-insurance, all of that will remain the same. LPSS is responsible for dictating what is covered and what is not. And again, they asked us to mirror that. So there will be no changes there. Another thing is really just as I said earlier, Meritain's really kind of the engine behind the scenes. We're just processing those claims based off of what Lafeyette tells us should be covered and paying on behalf of Lafeyette. But we're not dictating what's covered and what's not covered. Okay? So you shouldn't see any changes there. It has some head nods, so I'm assuming there may have been a question about that. All right, transition of care. This, if you have a provider that you see today and they're in network with Aetna or Verity, nothing changes. You can continue to see that provider for all of your services. No referrals are required. You just go straight to your specialist if you need to, okay? If you see a provider that is not in either network, so we consider those out-of-network providers, and you have a pretty serious condition that you're seeking treatment for, there is what we call a transition of care program that's in place. This transition of care allows you to continue to see that provider for a certain amount of time while being treated. So here are some examples. And again, just to reiterate, this only applies if you're seeing a provider that is out of network come January 1 and you have one of these conditions. Maybe you have cancer and you're seeking or receiving chemo treatments, radiation treatments, organ transplants if you're under active treatment for that, inpatient hospital stays past the effective date. So let's say you're admitted December 30th and you're there until January 5th. That's an example. Post-acute injury or surgery within the past 3 months. So if you had surgery in December and you need to do a follow-up with that provider, that would be considered under transition of care. Pregnancy, second or third trimester, and any continuing behavioral health treatment. So again, this only applies if your provider that you're seeing today and you're getting these services is out of network. Okay? You would qualify for transition of care. Pre-certification, this works like anything. It's going to work the same way it works under Blue Cross Blue Shield, the same way it works across every carrier, which is if there is a condition and a treatment service that requires a prior authorization or pre-certification, same thing, it does have to go through a review process, right? And what Meritain will do is it'll look at your benefit plan design, what LPSS has agreed to cover, and if those criteria are met, then it's approved. If the criteria is not met, it's declined. Again, it works the same exact way it works today with Blue Cross. If you have a procedure, let's say in December 1st, you have a surgery that's planned for January 15th, and it's approved under Blue Cross Blue Shield, we have requested Blue Cross to send us that information so that you and your provider don't have to go through that pre-approval process again. We will collect that information, we will load it into our system so that come January 15th, you don't have to go through the pre-cert process, you're already approved in our system. Okay? Again, we will get that list prior to. Now, if it's past January and then you have something new that requires a pre-certification, then it would start new with Meritain. Keep in mind, though, with pre-certification, your only job is to make sure your provider knows who your benefits are under, right? They just need to copy the ID card. They manage the pre-cert process. They know where to call. They know who to send it to. They know what the requirements are. You on your member portal, I'll explain this in a bit, but when you log into your member portal, you can actually see the status of that pre-authorization. You can see if it's pending, because we need more information from the doctor, if it's been approved, or if it's been denied and why. So you have access to all that as well, which is really nice. A lot of transparency there. But again, you don't have to do anything. That's on your provider to submit that pre-certification to us in advance. Okay, the member portal. I highly recommend come January 1st that you register for the member portal. We have, if you're anything like me, who is a visual person, we have a YouTube video who will show you how to register. It's very easy, or we can provide you with printed instructions. You just go to Meritain.com and you register. And you can register with your social security number and your information, like your name, date of birth, or with your Meritain member ID number, which you will have on your ID card. But if you don't have your ID card present and you want to quickly register, again, you can do that with your social security number. I recommend that you register because you basically will have access to all of your benefits on there. You can pull a copy of your ID card, you can review your explanation of benefits, you can view your plan designs, you can check on claims, past claim status. Really, everything under medical will be provided to you through the member portal. And you can also download it on your smartphone as well. Okay, so here's an example of what the ID card will look like. We are still working on this. It's not the final copy. So just know that this is just a template, but I thought I'd go through it with you all so you can see. But you can see Lafeyette logo will be at the top, right-hand corner, Meritain and Aetna on the left. Under member information, you will have your member number, your group number, your information, and if you have any dependents under the age of 18, they will also be listed on those cards. We will release ID cards to every dependent over the age of 18. So if you have a dependent that's 18 and over, or a spouse 18 and over, they will receive their own ID card. On the top right-hand side of the front cover, you'll see that there are two logos on there, and that's the network section. So you'll see the Verity network, and you'll see the Aetna network. That's really more for visibility for your providers when you go and see them. Okay, they just want to see that logo. So like I said, when in doubt, if somebody doesn't, the front desk person doesn't know who Meritain is, it's okay, just say, I'm part of the Aetna network. Okay? On the bottom right side, if you are an active member, you will have Optum RX as your pharmacy, benefit manager, and we've included Optum's information on the bottom right-hand side. So you'll notice that your co-pays will be indicated on there. The customer service number for Optum is indicated there. We try to put everything on one card to make it a little bit easier for you. If you call Meritain, though, just note they will tell you you will need to contact Optum because Optum is a separate company from us. So they will be administering the pharmacy benefits. But again, trying to put everything in there for your review. I'm going to skip real quick and then I'll move to the back. For those of you who are Medicare eligible and elect, you will have Med Impact. I know Trish mentioned earlier that currently you have a separate ID card for the Medicare eligible. Now you will only have one card with the pharmacy and medical, but you will also need to have or bring your Medicare card. So do not throw your Medicare cards away. You'll still need to present your Medicare card, and then you'll have this card, which will have your Med Impact, which is your pharmacy information. So now you've gone down from, what, 3 to 2. Does that make sense? So don't throw your Medicare card away, keep it, and then also have this card, which has your Med Impact information on it as well. Did I cover it? Good. Anything to add?
Mail order in Optum is non-Medicare also.
Okay, mail order and, okay.
Just a quick add before we move on. So the Optum card is also for members who are not under Medicare, okay? So active members to include, so when I say not under Medicare, if you have any part of Medicare, Medicare A, Medicare B, or Medicare A and B, you're going to be under Med Impact administered by Vibrant RX. When we do some question and answer in the end, I'm going to keep saying that statement, okay? Because I want you to make sure that when you get your information in the mail, that you're not throwing away an important envelope that's going to have perhaps your card in it. But we're going to communicate with you, give you heads up as to what's coming. We're going to communicate all the way through December and let you know. But Optum RX is for non-Medicare members, and Med Impact, administered by Vibrant RX, is going to be for our Medicare members. So now the Medicare members will have a combined card. You won't have silver scripts in addition to your Blue Cross is what you currently have. It's going to be one card included with your medical and your pharmacy.
Okay, and on the back of the card, we'll provide you with all the contact information, the claims address, the provider number, the customer service. So that is more for your provider mostly, but also information that would be helpful to you as well. Trish mentioned something that's very important. Once the ID cards do go out, which will be around mid-December, they're going to come in an unmarked envelope. So don't be like me and throw away all unmarked envelopes. I rip them in half right away and throw them away. Don't do that. make sure you check. The reason why we have to send them in unmarked envelopes is because there are some of your information is on there, like your name, your member ID number, no other private health information, but we want to be always really careful and cautious of that. If you do throw it away by accident, it's okay. We can always send you a new one. There's always one that's digitally available as well on the member portal or through your smartphone. So again, don't panic if you do that. It's okay. We'll get you a new one. And I'm sure nobody would panic. I'm just using myself as an example, by the way. Who would probably panic? Okay. There is one thing that will be required of you, which is other insurance coverage. So when you get your ID, your member ID card, you will also receive a letter in there that asks if you have other insurance coverage. This is incredibly important because of coordination of benefits. If you have other coverage, we need to know how to pay those claims, right? So if we are secondary and you have primary insurance, then we need to make sure we pay properly. So that's a very important question that we ask. So if you get that in the mail, you can either go to your member portal and update that status to yes, and here's what I have, or no. You can also call customer service. Just call them and say, can you please mark other insurance as no? And that will be marked in the system. So you can either call or you can do it on the member portal.
Is that for non-Medicare?
Yeah, that would apply to everybody.
Everybody?
Yes, so if you have Medicare, it's important that we, yes. Yes, so again, you'll receive that letter in the mail. Come January 1st, you can update that information by calling customer service or updating it on the member portal. Yes?
I'm not sure I understood. Are you saying we're to count, Medicare can be, Medicare is my primary, you all would be my secondary, or Aetna is my secondary, and if I have a third coverage, let you know about the third coverage?
Yes, any other insurance that you have, we would need to know. Yes, ma'am. Yes.
Other than Medicare.
Okay, so her question was, if I have Medicare, do I need to fill out that form? Yes, you do. Medicare would be considered other coverage. Keep in mind, all of this is going to upload to Meritain. All of our Medicare eligible members in particular is going to upload, but Meritain needs you to either fill out the form or call or do it through your portal to update Meritain with the other coverage information. So if you have Medicare, yes, it is super important that you fill out that information and let Meritain know. Does that help?
So Medicare will not be the primary.
Medicare would be your primary if you have Medicare A and B. Yes, ma'am. Even if you have Medicare A or B, Medicare, depending on the example and the service, would run primary.
You won't be using the card itself, the Medicare card itself.
Okay, so her question is with regard to Medicare. A, you never get rid of your Medicare card. You always use it. You pay your premiums when you see the physician, and if you have Medicare A and B, you're going to present them with your Medicare card in addition to your Aetna card, just like y'all did with your Blue Cross. Okay? Same process. You're on the same track. You're going to give them both cards if you're under Medicare, your Aetna and your Medicare card. Does that help, ma'am?
Yeah.
Okay.
I just know that was the primary, Medicare is the primary. This will be the secondary. Okay.
Yes. If you're Medicare eligible, Medicare would, and you're retired, key piece, your Medicare will run primary.
Okay, I think one of the things we could the third insurance would be like if you have cancer care.
I'll give you an example of a third insurance. Maybe your spouse has insurance and you guys have Medicare and you have LPSS and maybe you have your spouse's coverage too. Any additional insurance that you have, you need to list it on that other coverage questionnaire that they're going to be including when they mail your Meritain member ID card. Does that help clarify it just a bit? No, cancer insurance, critical care insurance, accident insurance, that's not insurance. We're talking about group or health insurance, other health insurance is what we're referring to. Not a supplemental policy is how I would refer to the others. Does that help clarify? I'll take one more question and then I'm going to turn it over to Ms. Melissa. Yes, sir. A VA would be other coverage, yes, sir.
Okay, when earlier she said that if you have your current insurance with LPSS and Blue Cross, it will transition. If I currently have Medicare and LPSS Blue Cross, it will transition. Do I still need to answer that question?
Okay. Yes. Okay. So let me repeat questions because not everyone is going to be able to hear what he asked. So he's asking, what do I need to do? We told you guys your insurance is going to change over automatically, right? We're going to move from Blue Cross to Aetna automatically. But Meritain still needs the other coverage questionnaire filled out. What that helps do is that ensures that your claims continue to process accurately, okay? There's going to be a threshold on there that makes sure that when claims process through, that they're running under the primary or the secondary or perhaps the third insurance. So your medical is going to transfer over, but that's one more step you're going to have to do when you get your member ID card. You're going to have to fill out that form, or you're going to have to call Meritain, or if you're doing it online, you're going to have to enter the information online. Does that help clarify? Okay, I see nodding heads. Okay, I'm going to turn it back over to Melissa. We'll do some Q&A at the end to help answer some of your questions. Ma'am, can you hang tight, think of your question, and maybe ask it later?
I just want to know if that information has to be provided by January the 1st.
No, ma'am, no.
Okay.
No. Great question. No, it does not. It just, as long as we get it as soon as we can, that would be great. Because when a claim does come in, we need to know how to process it. Thank you. Thank you, Trish. Okay, so there are additional programs that are offered with the medical benefits that LPSS has elected for you all. I know that you're probably already familiar with some of these programs because they're in place today, but it's always nice to reiterate all the additional programs that you have access to. One would be 24/7 Nurse Line. So, as it states, it is available 24/7, and it is a nurse that you can call for guidance. Okay, so if you're not sure over the weekend if your symptoms may be ones that you should be going to the urgent care or the emergency room, they'll tell you. Or they may say, you're good, just give it another 24 hours, let's see how your fever goes, etc. So they're just someone there for free to provide you with guidance, the nurse, okay? A really nice option to have if you're trying to be talked off the ledge. Like I mentioned to the last group, if you have a baby, I call 24/7 Nurse Line on a weekly basis, okay? They're really wonderful and they do provide really great guidance. That number will be provided on your ID card, by the way. All right, Teladoc is my best friend. Teladoc is available 24 hours a day, 365 days a year. And it is a virtual primary care visit. So this is for minor sick visits. Let's say you think you may have pink eye, or you have a rash you want them to see, or maybe you have some flu symptoms and you really don't want to get out of bed for it. They can provide a visit virtually and submit a prescription to your pharmacy. So again, really great option for those of you, or if you're like me, who usually get sick on the weekends or evenings, right, when my primary care physician is closed. Also really nice if your primary care doesn't have any more visits available for you to go see them and you know it's pretty minor, call Teladoc. I highly recommend with Teladoc, here's a tip, that you register on at the beginning of January. Register with Teladoc. You'll just answer some questions about what medications you take, just like you would if you go to a brick and mortar, what your conditions are, etc. Because the last thing I would think you'd want to do if you're sick is register at that point, right? You'd be incredibly annoyed, I would think, at that point. So register in advance so that when you actually need the services, all you have to do is log in, indicate what you need services for, and you'll get a call back within usually 15 minutes. I usually get a call pretty quickly. Or you can schedule a visit, an hour, 2 hours out. But again, virtual visit, I highly recommend utilizing it. It is a less expensive option versus going to an urgent care, actually even going to your primary care physician, because then you're not sitting in a waiting room with other sick folks. You're not waiting, an hour plus. It's just conveniently in your home or in your car if you want to make that call. So, Teladoc is great. I love it. Okay, Meritain Health Nurse. Meritain Health Coaching. This is disease management. This is our own disease management program. So if you have a chronic condition, which is listed here, it includes asthma, coronary artery disease, congestive heart failure, chronic kidney disease, COPD, chronic pain, diabetes, high cholesterol, and high blood pressure. When a claim comes through to Meritain and you have one of these chronic conditions, it will be flagged, and our disease management program, which is staffed by nurses, will reach out. They will either reach out via letter or they'll reach out of a call. It just depends on the complexity of your condition and how severe it is. If you decide to opt in, great, there's no additional charge for you, but you get access to a nurse who can give you guidance, can help you navigate the health insurance world that I know is quite complicated. But they're really your second line of assistance when you're dealing with a chronic condition. Not all of our PCPs we can just call and get a response quickly. When I say PCP, I mean our primary care physician. So just another avenue to have another nurse by your side to help you throughout your condition, maybe put a plan together for assisting you through your condition, and then again, helping you navigate it. But you do have to opt in. They will reach out a couple of times, and after that, they will stop if you're not interested. All right, maternity management.
More Medicare. You can skip that.
All right. All right, thank you for that response. That was great. You have maternity management coverage that covers mom from beginning phases all the way through postpartum. Good? All right, if you have more questions, I'll be here after you can ask me. All right. LifeMart is a discount program, so it is just another add-on. This discount program is really great. You can get discounts on health and wellness needs, promotions, wellness products, gyms if you want to join a gym, deals for your family if you're traveling with family, you're going to an amusement park, let's say for instance. You can get discounts there. So I highly recommend this. Will give you a QR code. It'll take you directly to LifeMart. You can also access it through the member portal, but it'll take you to a different site where you can access those discounts. So what I usually do is I go in there, I type what I'm looking for, because there's a ton of offerings there. So a nice add-on for you all. All right, has anybody heard of Minute Clinic? They're in certain CVS clinics. Okay, good. So there are certain CVS clinics nationally that have a Minute Clinic in them, and they are serviced by nurse practitioners or physician assistants, and they act as a primary care for sick visits. Very convenient, more affordable than an urgent care would be, and like I said, convenient because you can get your drugs while you're there. If you decide to get your drugs at CVS, you don't have to get them there. But really useful if you are traveling or on vacation and you go to a major city. A lot of the major cities throughout the country have CVS with Minute Clinics. So if you're on vacation and it's the weekend, again, if it's minor, instead of going to the urgent care where you will pay more, wait longer, I highly recommend going to your member portal and searching for CVS Minute Clinics near you and scheduling an appointment there. I actually do this. So this would be for things that maybe Teladoc wouldn't be a great use for. So let's say you think you may have strep throat and they actually have to test you for strep. This would be a reason why you would go here versus doing Teladoc. Okay? Or you want them to run a COVID test for you, things like that. So anything. So it's kind of in the middle between your Teladoc and an urgent care. Okay, that is it. Any questions? Again, I know we're trying to give you little bits and pieces of this through time. I'll come back to you. Let me.
When you mentioned Teladoc, I didn't catch whether it was a free service or not.
Teladoc.
Whether
it's a free service.
Yes. Did we build it? Okay. I'm sorry.
Her question was Teladoc free? So keep in mind, I'm going to send lots of information on all these services that Meritain's presenting to you today. You're going to get them all the way through December. Teladoc will be like it is under Blue Cross. There will be a charge for it. It will be at a reduced cost. With Meritain, please correct me if I'm wrong, Melissa, there's nutritional, there's dermatology, there's general medicine, and behavioral health. I knew I was forgetting one. So if I remember correctly, not all of those services were available currently under Blue Cross. So you've got some value-added services to which you could use under Teladoc at a reduced rate. So be on the lookout for my communications. We're going to emphasize all these new services and then some. The more information we learn, we're going to pass it on to you. And then it will give you how much your cost will be under those particular services based on the plan that you're under. Okay? So be on the lookout, more information to come.
And on that, you will always be, they will actually show you through the Teladoc app what your cost will be for the service ahead of time so that you can make that decision. But yes, general medicine, the mental health covers psychiatry evaluation, psychiatry ongoing sessions, and psychology sessions, and then nutrition and dermatology as well.
How does that relate to Medicare patients? To Medicare,
She can still use them, but
Okay.
I mean, you use them, you'll bill Medicare, and then how does that work? Like if we go to urgent care,
Mm-hmm.
they bill Medicare, then they bill Blue Cross right now.
Right.
So if we use Teladoc, is it the same thing?
work towards your deductible and not exam.
It would work towards your deductible. Thank you.
Yes.
I have to think about that. Yes, ma'am, all the way back.
Prior authorization, about how long does it take, and is there an appeal process?
Yes, great question. So her question was, what is a turnaround time for prior authorizations, and is there an appeal process? The prior authorization turnaround time can be anywhere from 24 hours to 72. It really depends on the provider. They know what criteria has to be met for each prior authorization that they submit. So as long as we get all the data from the provider, it's a very quick turnaround because it's all electronic. However, if a provider doesn't get us everything that we need to review, then there will be a delay, and I cannot tell you how long that delay will be. We'll just reach out to the provider and let them know what we need. If that prior auth is denied, yes, there are 2 appeal processes. And if you call customer service, they can help walk you through that. Yes, ma'am.
I have 2 questions. I've sat here very quietly and listened very patiently, so I have 2 questions. One is, right now, I get my medicines at CVS brick and mortar, even my 90-day supply. So Optimum RX, I would need to make sure that CVS would accept this new insurance?
Well, to my knowledge, CVS is part of the network.
Okay, because
So
I
those
do see
benefits-
CVS on one of your slides.
Okay, so CVS is an owner, but they have nothing to do with your pharmacy benefits. Optum is a separate pharmacy benefit
Still
manager.
need to show them our new card, and they would throw it out
Correct.
on their end.
Yes, exactly. So yes, the question was, do I just show them my new card with my new pharmacy benefits? Yes, you would show that when you go to the pharmacy. they have the correct information to process that, and that's automatically at point of service. So yes.
Okay, second question. I realize Meritain is just paper dealers processing forms. I understand that. Y'all, created the contracts and, you oversee that. Right now, I call a doctor wanting to know if they accept my insurance, which right now it's easy to say. You take Blue Cross Blue Shield of Louisiana? Yes, we do. Now I need to call. So how do I ask for this? Do I have to mention Verity and Aetna? How would I call Dr. John Smith and say, do you take what? Aetna? Or do I need to say Verity or Aetna or Meritain? What's the best way, what's the best verbiage to use for this question?
Great question. So the question, did everybody hear that? Okay, perfect. So there are multiple ways to search to see if your provider is in network.
Yeah, I don't want to check the portal. I want to make a phone call.
You want to make a phone call? Okay, so you can either call customer service on January 1st.
I want to call the doctor. The doctor's
Okay, so you would call the doctor, yes, and say, do you accept Aetna Choice POS2?
POS2, and POS stands for what?
2, point of service.
Point of service. Okay.
Yes, do you accept Aetna Choice point of service 2?
Right, okay.
Sometimes they'll have it on their website, they'll indicate it, but sometimes they don't, it just depends. But that's what you would ask them. If they say no, then at that point you can say, yes, yes ma'am. If they say no, then you can follow up with, well, are you part of the Verity network?
Okay, are they part of the Verity?
Verity will always be secondary because more than likely the majority of the providers will fall under Aetna, right? So that's what you want to ask for first because Verity is a local network, so there won't be as many providers there. So yes, first you ask, do you accept Aetna Choice POS2? And then Verity.
I don't have a printer. I don't work. I don't have a computer.
Yep.
I don't have a printer. So
Okay.
I go to the library to do it.
Okay.
You see, you retire, you have none of that anymore. So.
Listen, if it makes you feel any better, I have those things and I don't use them. I call everybody. Everybody. I get made fun of all the time. They're like, why don't you call to make appointments for everything? Because I'm a caller. I don't text.
We don't need to say
Yep.
Okay, thank you.
You're welcome. Of course. Yes, ma'am.
So why aren't we saying Meritain if that's the insurance?
You can, but a lot of the front desk folks don't always know who Meritain is, so we always say, when in doubt, just say the Aetna network. And you'll present your card when you get there.
But not all Aetna has Meritain.
That's correct, but it's all the provider cares about is what network they're under and the contracts that they have with Aetna. So we process the claims a certain way, but Aetna is a network. You can say Meritain. I'm just trying to make it easier for you all to navigate with the providers. I haven't, yes ma'am.
Will Optum automatically get those from Caremark, or will we need to apply for our whole set of prescriptions with Optum?
Okay, so her question was, it sounds like I have mail order right now. Will that mail order essentially carry over to the new pharmacy provider? Okay. We are currently working through the pharmacy. We have meetings every single week with all of these new changes that we're undertaking between Meritain, between Optum, and between MedImpact. The pharmacy is taking longer based on CMS standards. I'll give you an example under MedImpact. Members have to be notified first based on certain steps from Silver Scripts, then onto MedImpact in order for members to be communicated directly based on the new services January 1st. When the open enrollment packets get sent out on Friday, we're going to send them via text and via email. You're going to have access, in particular the Optum members are going to have access because I now have information under Optum with regard to pharmacy locators, where can I get my drugs, okay? What tier is my drug going to fall under? That's going to be a lookup for you within the documents that will be sent to you on Friday. As the meetings progress, we're going to learn more and more information about prior authorizations, mail order, specialty drugs. We're not quite there. So I'm going to send you the information that we currently have, and then we're going to incrementally update you as it progresses. So I don't quite have an answer for you yet, but you will get one. Yes, ma'am. Some of that information, particularly under Medicare eligible members, is going to take a little bit longer based on the CMS regulations. CMS requires that the current provider, which is SilverScripts, that they notify you so many times prior to the new provider, MedImpact, Vibrant RX, before they can start sending notifications to you. So CMS wants to protect you to make sure that you get the information that you need. So it's going to take just a little bit longer for our Medicare eligible members to get the information that they need with regard to pharmacy, but it is coming, and I promise you'll get communications on it. You'll hear it from the department, so I'll put a plug in to make sure that we have your point of contact information at the district. Our primary source of communications is email, to include text messaging. You are going to get some print items, but keep in mind we're limited in what we can send because it's a lot of information. The electronic gives us more resources because we can attach clickable links where you can read more and obtain more information so that you're more informed. But it's coming, ma'am, just not quite yet.
Trish,
Okay.
just real quick, point of clarification for the
Okay.
both pharmaceutical plans will provide either mail order or be able to use a local pharmacy, is that correct?
Yes, okay, so her question was, both pharmacy providers, are we essentially going to be able to still have the same benefits that we're doing right now, like mail order, prior authorizations, specialty medications? Yes, all the same services that you had before, you're going to have the same services with the new pharmacy provider. It's just that I don't have all the fine details for you yet. I don't want to put out that information in case I communicate it to everybody and then it's incorrect. So we're working through that process. I promise you, when you get your information on Friday, you're going to have some info. I want you to read through it, and then we're going to send you more and more information as it progresses. But yes, you will have mail order services. It's just I don't have all the fine details yet.
So before we make any decisions, we should really wait until we get all of this information you're going to mail to us.
Keep in mind, it's going to take time for that information to come because there's requirements in particular with Medicare eligible members. But her question was, should I pause and wait on making any decisions? I would say educate yourself in this process, okay? That's why we were having educational sessions today to introduce you to your new provider, Meritain Aetna, okay? Give you some information on what's coming. We also are providing that Humana session after this one. The open enrollment period is around the corner, but keep in mind, you may not have all the details that you're seeking at the end of open enrollment, okay? Which way did we go last time? Okay, ma'am in the back, I saw your hand first.
How much is our payment per month for this new insurance company?
How much is your payment, like your premium, ma'am? Okay, her question was essentially, are my premiums increasing? The board did not approve for any premium increases. Your premiums are remaining the same. Keep in mind, the board made this decision based on the current fiscal year. Fiscal years from July 1st of 25 to June 30th of 26. We will be, before you know it, budget season will be here, and we'll be discussing next budget season. So I don't know what the board will decide moving forward, but I can at least answer your question now. There is not a premium increase for January 1st. Okay. I saw a lady in the back. Yes, ma'am.
Trish, that was my question. Thank you.
Okay, you're welcome. I'm sorry.
Yes.
If you're Medicare eligible, is it your drug's going to be the net impact that being covered?
Okay, her question is, I'm Medicare eligible. What is going to be my pharmacy provider? Okay, if you have any part of Medicare and you're currently under SilverScripts, that's another key piece. Okay, you're going to have MedImpact administered by Vibrant RX, right? Okay, I feel like I need to do a Q&A. But Med Impact, if you have any part of Medicare, Medicare A, Medicare B, or Medicare A and B, that's going to be your new pharmacy provider. Optum is only for those members who do not have any part of Medicare. Does that help clarify it? Okay. Yes, ma'am.
If I don't change, if I stay with status quo, everything, I do not have to open enroll, do nothing.
Okay.
Sit in my house, right?
Okay. Her question was, if I don't want to do anything, okay, she's currently under Blue Cross, okay, she's under Blue Cross, and I'm going and Silver Scripts because she's a Medicare eligible member. What do I need to do, essentially? We're going to roll you over. You don't need to do anything, okay? That means we're going to take your medical from Blue Cross to Aetna, okay? And we're going to take your pharmacy from Silver Scripts to Med Impact Vibrant RX.
And all of this is for my wife, and please send me via email or via text. And if I'm confused, I'll call out.
That was awesome. Y'all didn't get to hear it, but I'll repeat it. I don't think I can repeat it like she said. So all she's got to do is wait for her member ID card. Okay, member ID cards will come in mid-December. They're going to come ahead of January 1st because we want this to be a smooth transition for you, right? We want you to have your member ID card and you feel comfortable because now it has what? It has your medical and your pharmacy on it for our Medicare eligible members, right? So then your card's going to come in the mail in the unmarked envelope, right? Okay? You're going to fill out the what? Other coverage questionnaire, either via form, via phone, or via your online portal, if I said that correct, right? And then you're going to go about your business. And if you have questions, you contact the insurance department, because I am sending this to active members too. So I won't list the specific staff members. So yes, if you don't want to act or do anything, we're going to do the heavy lifting for you, okay? Meritain and all of our wonderful providers, our Optum and our Med Impact, administered by Vibrant RX. Okay, we're going to do the heavy lifting. You're going to get your card and then you're going to use your card like you need to. Yes, ma'am. I saw your hand, sir.
If we want to send to a different address than you normally have on, how can we?
His question was, if I want that card to go somewhere else, what do I need to do? Connect with our officer. We'll update your address information. Just keep in mind, if we update your address, it applies to all of your point of contact information.
Well, it's going to be a temporary, temporarily.
Then I would say update the post office, maybe, and have it route.
Well, the problem is with mail forwarding, sometimes it takes 2.5 weeks to get the mail.
Maybe connect with us and maybe we can direct you better. I see your hand in the back, ma'am, and then blue shirt.
What's the customer service number?
Okay. Okay.
What's the customer service number?
Okay. What is the customer service number? We can't divulge that just yet because it's not live. However, because your plan's not active yet, y'all. We're still working through that process. We're working behind the scenes getting it all done, okay? So you will get the information, I promise, and where are you going to learn it from? You're going to learn it from us. Okay, so other key pieces. You're going to get email. If we have your email on file at the district, please update us if you don't. If you'd like to put a loved one, like maybe your 90-year-old mother does not check email, right? We can put somebody on that email address to make sure that those notifications get to that member. Okay, so we got email, we have text messaging. We have the department website. We are going to have a Open Enrollment Plus sign on our website that has all of this open enrollment information to include any time a communication goes out, we dump it to our department website. So even if you don't have an email, there is access on our website that will take you to those communications. We are working on some print communications. Not everything can be done in print because there's a lot of info coming to you guys. So the best resource, in all honesty, is electronic, because then I can attach additional information to it so you can read more and get more informed. But it is coming to you. There are going to be lots of information, like Ashley mentioned at the beginning. It's going to be like eating the elephant, right? We're going to take one bite at a time. We're all in this together. We're working towards that goal. We're going to inform you along the way. The more information I know, I'm going to push it out to you, because I know you're concerned. I know you're a little nervous about this changeover. I want you to feel comfortable with the changeover. We are working on your behalf behind the scenes. There's a lot of people working on your behalf. We want this to be a smooth transition. So I want you to engage in our communications. I want you to read our communications, okay? And then if it's confusing, I understand that. There's a lot of info coming at you. Reconnect with us, okay? Keep in mind, Ms. Ashley is one person, and there's a lot of retirees, okay? So just be patient. Every single time we go through a transition, my statement is, I need your patience. I need your grace. And I know you're concerned, but we are going to get back with you. I'm going to put other staff members to assist Ashley. We're going to get back with you. But there's a lot of moving parts here, and I know you need answers. So just be on the lookout for my communications. Read them, and then reconnect with us if you have specific questions that we can help with.
I did, and I'm not part of this group, my wife had to leave, but I was just curious to see why y'all made the transition between Blue Cross, Blue Shield to Aetna. I know this is maybe...
Okay, this question, why did y'all move? Why did you go from Blue Cross to that transition? The best answer I could give is we do have a board insurance committee now that are made up of board members, that they have been meeting on a regular basis, assessing anything insurance related. And then any recommendations given by the board insurance committee is always given to the board. We work by board direction. The board directs us. We do have a self-funded health plan. Costs are increasing. The board insurance committee, to include the board, is assessing all those costs, and they made that decision. So we're all in it together to include active and retired members.
I think bringing in a third party would just increase the cost of the
But what you don't understand, he said, I would think bringing in a third party would increase the cost. Blue Cross is a third party.
Yeah.
Mm-hmm. They're a TPA. They are a TPA, and they are an insurance company. They are one and the same. What you have here with Meritain Aetna is you have a TPA, and the insurance company is Aetna. So it's not increasing costs. You have the same thing with Blue Cross.
Does this apply to everybody, the retirees and all the active?
Yes, his question was, does this apply to everybody? It does. I'm an active member. I am not a retiree. It impacts me too. Okay. So then the video that's going out today, I'm sending it to active members and retirees, which is why we had the maternity slide. Just saying. So just to keep you informed, and I know it perhaps is not applicable here, but we're all in the same boat, going through the same transition. We're learning it like you are, and then my goal is to try and make you feel comfortable. Like, the whole goal of today is to have you come, get a little bit of information, hopefully feel a little bit more comforted, know that what I'm going to tell you is I'm going to send you more information along the way, okay? I'm going to keep you informed. I would want to know. Like, I want to know how things are going to progress. We're not going to hold stuff from you. We're going to send it out as soon as we can, but I don't want to overload you. That would be like drinking from a fire hose, okay? So I'm going to have to give it to you in bits and pieces. I need you to digest it a little bit. I'm not going to promise anything, but I would probably say that at least during the open enrollment period, you're going to hear from me at least once a week. And then as we progress and I learn more information, I'm going to start giving you details about pharmacy. I'm going to start telling you more information about Meritain. Like, Melissa went through a lot of key pieces, but I'm going to send you those flyers that tell you more specifics, like your EOB and how to get connected with the portal, and videos. okay, to help you stay informed so that you're educated. It's coming, y'all, but it just can't come right now. It's going to have to come in bits and pieces, and I need you to be just a little bit patient. I know you're concerned, but we are working on it. We want you to be informed, and that's why we just wanted to make sure that you're educated on everything that's coming your way. Yes, ma'am.
For me, from my viewpoint, I think what the concern is, over the years, anywhere you go, Blue Cross Blue Shield was always recognized. And my parents, and so I learned that this is good. And I think in our minds, even though I understood a long time ago, we're self-insured, they have nothing to do with our rates. Our self-insurance is what controls our rates, not Blue Cross Blue Shield. But it's the idea that that was just recognized and accepted. So when I heard Meritain, no offense, no. But as soon as I saw Aetna, thanks to my eyes being able to read, I said, oh, I know Aetna. I know Aetna. That's amazing. It made me feel better.
It made you feel better. Okay. So she's saying it made it feel better. Y'all, we've been with Blue Cross for forever. Okay? I can understand your concerns. A lot of you in here, you likely had it as an active member for all the years you were there. Now you're as your retiree, and now you've got to change. It's understandable. But keep in mind, Aetna is a national network. Y'all do know the Aetna name. We are working hard behind the scenes to make sure that those plan documents that were established under Blue Cross are mirrored with the Aetna plan. Keep in mind, there's laws and a few things that have changed. There's going to be tweaks here and there, but for the most part, we are mirroring it based on laws and regulations from one plan to the next. So just keep that in mind when you're trying to make your decisions. Yes, ma'am.
Okay, if Aetna or Meritain is mirroring Blue Cross, why change?
Cost. Our question was if Blue Cross is, if we're mirroring the plan documents from Blue Cross, why are we changing? It's a cost factor. Blue Cross is charging more for those services, more for those claims. The district has to review that. We're self-funded. We have public dollars. Ma'am, everybody, active members and retirees, everybody's in the same boat.
Don't look over me. I saw you try.
I saw you got two questions. Yes, ma'am. How can I help you?
What is the difference from Aetna to Aetna Choice?
Melissa.
Okay.
So, and that has multiple networks. The Aetna Choice POS is our strongest network. It is our largest network. It is a network that has the deepest discounts. But we do offer other networks, regional networks, maybe a PPO network. But the Aetna Choice POS is our largest and our most aggressive network.
So it's important to say Aetna Choice.
Yes, and like I said, if somebody at the front desk doesn't know, call customer service and ask, or you can send an email. I'll look it up manually for you. I don't mind. Okay. Oh, yes, behind you, and then I'll come in you.
Okay. Silver Scripts has tiers. Is that going to be about the same as like Vibrant, the same price point?
Great question.
There, yes. Need that.
Okay, her question was, I'm in Silver Scripts and there's tiers. The tiers are still carrying over at the same copay amount based on the plan. Yeah, still the same. To include Optum, to include Med Impact. Keep in mind, just like Melissa mentioned earlier, your medical, your deductible, your copay, your co-insurance, your maximum out of pocket, all that information is staying the same based on the changeover too. Okay, apples to apples based on deductible and everything else. Yes, sir, I saw your hand.
On the RX claim, y'all said you're still working everything out. Is that part of that it may not be Caremark, CVS?
Oh, it's not going to be Caremark. No, ma'am. It's going away. Kind of like your Blue Cross is going away. The RX benefits CVS is going away 12/31. Okay? The Silver Scripts, which is Medicare members, is going away. The district, the board approved a new health insurance provider, which is Meritain Aetna. Okay? They approved 2 new pharmacy providers, which affects retired members and active members under Medicare and not Medicare. So then your new pharmacy providers effective January 1st is Optum RX for our non-Medicare members, and then MedImpact administered by Vibrant RX, okay, for our Medicare members.
So for like our specialty medications and everything else, we will go through them?
So there is Prudent RX for some of our specialty medications. Some of our members are under that. That will be ending on 12/31 also, and that will be administered by Optum because that affects our non-Medicare members. Okay? If you have a specialty med under Silver Scripts right now, it would be administered by MedImpact, Vibrant RX. Okay. I saw you.
So what pharmacies would we still be eligible to use CVS?
Oh yeah. Y'all are thinking that you cannot use CVS. You can. Okay? We're going to send out a pharmacy locator. You're going to be able to type in your zip code. There's like 65,000, 70,000 pharmacies. You pick one of them. Okay? So it's going to, members get confused with that piece, and I totally understand it. It's not CVS that you have to go to. There's mom and pops, there's local pharmacies, there's Target, Walmart. Anywhere that is accepted is the key word. We're going to send off those pharmacy locators so that you can figure out where you can get your drugs filled. Yes, ma'am. Okay.
And it's across the country. It's not just.
It's all over. Yes, ma'am. I saw your hand, sir.
Through CVS, I get my prescriptions for a 90-day refill. It's an automatic refill. Will that still be in effect with this policy?
Yes, 90-day refills will still be available to you no matter which plan you're under, either the non-Medicare, the Optum, or the MedImpact. Yes, still available. Yes, ma'am.
So the prices that you had over there, if I'm not mistaken, those look a little bit higher. So, or is that
No, ma'am. 15, 40. So generics are 15 under the copay, 45 under the preferred, and 70 under the non-preferred. It's 10% up to 150 for your specialty meds.
like Eloquence would be considered a special?
You're going to be able to pull up the tier. These are all tiers. So tier 1 is generic, that's the 15. Tier 2 is the preferred, 45. Tier 3 is the non-preferred, 70, and then the specialty is tier 4. So you're going to pull up those tiers, and then you're going to know the cost of the med. Okay. How about 2 more questions, and then what I'll do is I'll connect you with staff, and then we can get your name and telephone number or email, and we can help answer your individual questions. Yes, ma'am.
So are TRIA health benefits going away?
That's a good one. We had that one in the earlier session. So she said, what about TRIA Health? Okay, TRIA Health is still on board. It's a point solution that the board approved. It's for those members with chronic conditions. If you have a chronic condition, I strongly urge you, connect with TRIA Health. It does take a little bit of time to get set up, but our members who have now worked through TRIA Health, it's a licensed pharmacist. They work with your physicians to help ensure that your chronic condition is best managed. So if you're not connected with TRIA Health, get connected or we can point you in the right direction. The open enrollment materials will have point of contact information on TRIA. It does take a little bit to get set up, but I think in the end you'll be very happy.
Is this a PPO?
Yes, ma'am. Still the same, well, PPO and high deductible. She asked, is this a PPO plan? It's the basic and the enhanced are the 2 PPOs and then the high deductible plan. So just thank you so much for coming out today, y'all. I really appreciate it. You asked a lot of really good questions. I'm hoping that you walked away with something, and that if you need help from us, please connect with us. Be on the lookout for our communications and make sure we have your point of contact info. Okay? Awesome. Thank you so much.
Thank you.